Hi everyone, welcome along to DigiShift number 62. So today's topic is digital innovation in health self-management. For those of you who are not aware of the term, self-management is about empowering people with long-term health conditions to take control of the treatment. We're going to hear a wee bit more about that from a couple of speakers that we've got today. So during this session, we're going to be joined by a couple of organisations that are actually shortlisted for the Alliance Digital Innovator Self-Management Award. So we've got Rob Murray, who's Chief Exec at Cancer Support Scotland, and we also are joined today by Elizabeth McDowell, who's Digital Skills Assistant at Leuchie House. We're going to be exploring, I guess, around self-management, but also some of the wider benefits that tech brings to health and social care organisations and the people they support as well. So I'm really looking forward to this one. We're going to hear from our two speakers, and we're going to have a chance for discussion and questions as well. So I'll hand over to Rob first of all, and then we will hear from Elizabeth.
Great. Good morning, everyone. I hope you're all well and it's not too cold or too wet. I think I prefer it to be cold rather than wet, but it's bucketing down the west coast today. My name's Rob Murray. I'm the CEO of an organisation called Cancer Support Scotland, and we help to improve the well-being of those affected by cancer across Scotland. We do this through a number of methods. So we provide counselling, we do group support, complementary therapies, and a whole range of digital resources as well. The charity has been around for about 40 odd years and predominantly based in Glasgow in terms of our head offices here. However, we deliver services across Scotland. And it's not just for the person with cancer, it's for their family members as well. Now, I'm going to take you back to 2020. I hope that's not too painful for people. We, in February, just after the gathering, actually, there's a wee plug for the gathering, launched our strategy Here for Your Wellbeing. And that came about after about a year's worth of consultation with partners, with people affected by cancer, and with our staff. And as part of that strategy that we launched, a key element of it was around transforming our services to be digital and provide a hybrid approach so that it didn't matter whether you lived on Orkney or you lived in Aberdeen, you were able to get quality wellbeing support. Now, that was a 5-year strategy. And 4 weeks later, we went into a national lockdown. And as a charity, we had to think quite carefully about actually what are we going to do, because all our services up to that point were face-to-face. It actually gave us the sort of boost that we needed to get on and do the job. But we wanted to do it with care and involve those affected by cancer as well. So within a sort of 6-week period, we held consultation events with a whole host of people. In fact, Ross was one of them, about how to deliver services online, how to do it safely, and actually what are the needs of people affected by cancer. And we very quickly launched our digital counselling platform and self-help resources on our website that took the form of video, audio, and written. And we also looked at our group work. How do we do that online as well? And our approach is all about making sure that people have got the tools to live well with cancer. So self-management approach. I'm pleased to say we were able to offer all our services online and also on the phone as well. There was a lot of feedback that people were feeling isolated and lonely. So we also launched a telephone befriending service that's now fully hybrid, which is fantastic. Some of the learnings from that period is don't be afraid to take the jump. We had, in fact, before I say this, round the room, have we got service people here? Anyone that actually delivers services themselves in their role? Just stick your hands up if you do. Okay. Anyone that's a service manager? Just interested. Here for the fun. You know that you're actually here for a workshop, yeah, on service delivery. Fine. Okay. Well, those that work with services know that there's sometimes quite a hesitance about not being in the room with people and a whole host of stuff. So actually it was quite helpful for us doing the consultation, because it meant our counsellors were able to see firsthand and hear from firsthand actually that people with cancer, it wasn't just a COVID thing. If they're going through treatment, actually gaining access to services from the comfort of their home was actually really beneficial to them. We also found out that there was gaps in information. So although we had Jason Leach on the TV every day, there was big gaps in information for cancer. And we launched something called the Wellbeing Sessions. And these were simple Zoom webinars. We had the Cabinet Secretary on, Jason Leach, a few other people. And they reached circa 45,000 Scots, which is truly amazing. And these weren't just information about COVID, they were actually ways of which people can help improve their well-being through self-help techniques, etc., etc. And that sort of webinar approach then led us to develop our mindfulness workshops. So on our website, people can, as I said, access self-help guides, but what they can do is sign up for mindfulness courses as well. And these were fantastic opportunities for people to just go in. If they needed mindful walking, mindful eating, mindful thinking, they were able to go in, and one of our trained practitioners were able to facilitate that. And I think for me, although COVID had many downsides to it, actually it was the catalyst for a lot of change for us, whether that's introducing our digital services or actually embedding Salesforce as well. And I know John helped get us on that platform. Other platforms are available, but it's been hugely beneficial. So now 2 years on, we're in a place that we're delivering hybrid services across Scotland. We're seeing a vast increase in people attending appointments rather than dropping out. So as you can imagine, if someone's going through chemotherapy or radiotherapy, the last thing they want to do is check out to a library or the Callan Centre or a community centre for counselling. So actually we're seeing an increase in people turn up, which is truly fantastic. But most importantly for me is we're seeing data. Everything's linked in. So it doesn't matter if you're getting a phone call from phoning in and getting some befriending support or accessing our website. We're collecting data on you in terms of the type of cancer you got, stage, where you are in your mental health journey at the start and where you are at the end. And that wouldn't have happened if we'd continued down the track of paper and trying to do things face to face. So it's been a revolution for us. And if folk are thinking about it, I really would encourage it, because it gives people the tools when they want them. You know, a lot of our services are 9 to 5, Monday to Friday because of funding. Whereas actually, if you find that actually you're low with your mental health or well-being, being able to jump on a website at the weekend during an evening and get that breathing resource, box breathing resource, or find out how you can take part in mindful walking or thinking or whatever it is so vital. So that's a wee bit about our journey. That's me done. Looking forward to any questions. I don't know if there are any already, but please get thinking. Elizabeth and I are more than happy to answer as many questions or as few as possible on this topic. But I think I'm handing back to Ross.
Thanks so much, Rob. Yeah, I'm sure there'll be loads of questions. If there's any that people are thinking about just now, and if you've not scribbled them down, feel free to put them in the chat, and John or Maddie and I will pick them up as well. We're going to hear from Elizabeth at Leuchie House with some of the work they've been doing, and then we'll get a chance for an open discussion and questions for everyone. So I'll hand over to you just now, Elizabeth.
Hi. I'll first of all just tell you a little about Leuchie House for those who don't know. It's a respite care centre charity in North Berwick, East Lothian, and we have people come to stay for between 4 and 12 nights, and these are people who generally have MS, Parkinson's, usually are in wheelchairs, well, almost always in wheelchairs, and it's a chance for them to either give their carer a break, or for those who have carers who are just coming in, you know, periodically during the day, just for them to get holiday as well. And we do look at ourselves as more of a holiday place. We have people do microlight flights and just pretty much anything you can think of. They go to the theatre and have podiatrists come in, haircuts, so lots of entertainment as well, music and things like that. And as part of that, people started asking about technology. And so I think about 4 years ago, before I started, they had one guest come in and he just said, well, I can't do, basically I get put to bed at night at 6 p.m. and then, yeah, my carer comes and wakes me up in the morning at 8 or 9. And between that period, he was just literally in the dark. So the difference that what we thought we could make was helping with tech. And that's when my predecessor started researching what she could do and took him to the Apple store and got him a phone. And then at least he could make phone calls, etc., because he can't use his hands or any part apart from his voice. So everything's about voice control. And from there, I started just before the pandemic. And then when we were furloughed, and this was used in the NHS, for the NHS, to have patients from the hospital, they could move into Leuchie House during that time. I used that time to set up the rooms as smart rooms. So all of our 18 bedrooms have Alexa smart speakers kind of the center. And then our guests can control the curtains, they can control the lights, the TV using a Fire TV Cube that's all linked in as well. And so they have access to Netflix and Amazon Prime and all the TV, and they can do that all through voice if they want to. There's the remote if they don't. So I'd say about maybe 30% of our guests use voice control almost all of the time. And there's more learning about it. And it tends to be, sadly, that the conditions are degenerative, so that you know, eventually they may lose the ability to use their hands. And voice also gets slurred, so we've got other things we're looking at for that, other technologies that can be helpful. So apart from having the room set up that way, we also do one-to-one talks, well, not talks with guests, but meeting with guests and seeing what their requirements are, which is often phones, laptops, Kindles, help with something they're interested in, like Ring doorbell. We also give a couple of different talks, one on tips and tricks with Alexa and one on just general enabling technology to our guests during their kind of fortnight stay. And that's a group thing, so people, you know, talk about stuff in there. And we're doing a project with SCVO actually on digital ethics. And as part of that, we're hoping to start a talk on security and privacy with guests, because that's an issue as well, just knowing more about it and knowing how to protect their data. And we're also doing a lot of collaborative projects, like with the University of Edinburgh and the National Robotarium. We're doing one called Feather, and it's very relevant for us because it's about UTIs, urinary tract infections, and how you could use artificial intelligence to see the change in cognition in somebody when they have a UTI. Generally, their speech becomes more slurred, or you can just look at other signs of cognition that they're not very well. So we're looking at a project to do that. And yeah, lots of other innovative projects that we're working on. So that's probably a starting point for me, if there's any questions on that.
That was brilliant, Elizabeth. Thank you. John, you were going to come in there, I think.
Yeah, it was really interesting to hear both stories. But I was really interested in the idea of, I guess people might come and stay at Leuchie House and then learn about things they might take back and use in their own lives at home. And is that something you're seeing?
Oh, definitely. There's a huge uptake. You know, people come in here and they've never used voice control to control their environment. And at this stage of their disease, basically they really struggle to get some kind of independence back and ability to self-manage. And, you know, the carers or their loved ones have to do everything for them. And it's really frustrating and difficult for them. They feel like a burden asking all the time. So, yeah, no, it's fantastic to be able to get something where they can get back in control. And I mean, I think we were going to talk about what the challenges are as well. I'm not sure if that's now, but one of the big challenges is, for us, we can't take on too much technology. We're only a team of 3. 2 of us are half-time, myself included. So it's hard to you've got to really know your technology yourself well before you show others. And there's a lot of technologies that we see people come in with changing needs all the time. One time they can use voice control, the next time their voice is slurred too much, and then we think, oh, what can we do? And so we can get some solutions, but a lot of the accessibility solutions that aren't just general off-the-shelf ones are really expensive, and understandably, because they're produced in small batches, etc. But yeah, it's trying to pinpoint what people need and then become an expert in it when you don't know who's going to come in as well. So it's quite tricky. But just there is so much out there, and I guess linking with other organizations and technology specialists is really helpful as well, and having people to refer to, like AbilityNet for us, who have a free service for people. Anyone with disabilities can get free IT support at home if there's a volunteer in their area. So things like that.
That's great, thank you. And yeah, I can see the point about starting with things that are easy to work with and work well, rather than trying to learn lots and lots of things. If there's any other questions, pop them in chat, because there's plenty of time to get stuck
I've got a couple of questions as well.
Go for it, Rob.
People are not. Yeah, I'm interested. I mean, I've got a couple of questions for Rob and Elizabeth. I think maybe just picking up on Elizabeth's stuff again. I'm interested in, there's lots of stuff happening in Leuchie House, and that kind of like almost like pipeline of innovative approaches to digital, and how you make decisions internally and what that process looks like. So like, someone has an idea, or you've seen someone else doing something, how do you get to the point where you kind of make that decision internally about adopting that new technology?
Yeah, I suppose it just depends on how many people we think are interested, what budget we have, and whether we think it's a technology that's worthwhile. I think when I first started, I bought a couple of things that we haven't used, to be honest, because people recommended them, but we hadn't tried them. And I think knowing more people in the area now and having groups where you can discuss, did this work? And also having a lot of guest feedback, because some of them are much more techie than others and will say, I've used this. That's the best recommendation. It's like, oh, that works for you. Great. Well, we'll try it then. And even guests, we want to get our guests showing other guests as well, because that would be a really nice thing to have. It's something I'd like to put on the website.
Cool, thank you. Yeah, I think one of the things that I guess really struck me about your experiences was it doesn't feel like an organisation that's kind of panically purchasing its way out of problems, but is more taking time to think about what your users need and what's working elsewhere, and speaking to trusted partners. And for me, that's probably a big lesson for lots of people in the room. Anyone else? Any questions or thoughts? Coming in? I've gone for Rob now. Do you? Oh, everyone has frozen for me. Oh, there we go. Right, it's back. I think it's my internet that's the problem here. Rob, do you have any form of content strategy, or if you don't have it kind of formalized, are you able to maybe share a bit like how you make decisions internally about types of content people need in terms of self-management?
Yeah, really good question. We, in terms of, here's a piece of paper that tells what the plans are for our content. No. However, what we do have is regular engagement within our team and with our supporters and people that access services. So we've got a group of people affected by cancer that advise us on a whole host of things, including service delivery. And our service manager and other staff are very good at linking in with these people and just finding out actually what is needed, what would help. So, early days of 2020, there was a lot of people wanting, and that's how the webinars came about with Jason Leuchie, etc., wanting information on COVID and cancer. Whereas actually, as time moved on, we were getting a lot of requests about, can we get stuff about how to relax, even though there's fears of germophobia and other matters as well. So so a lot of our content has been influenced by the people that access it as well. You know, we've got a few support groups. In fact, one of them is about to start making their way in just now, Knit and Natter. And we've been speaking to them quite a bit about actually what would help you over the winter period, and as COVID starts to rise again, how can we provide tools to help you at home or in the workplace just manage your well-being. So the team are currently working through that, and then our expert staff then produce that, and it goes online as well. So it's quite a collaborative process, and actually quite refreshing that we're not rushing, we're taking the time to do it, and that's been very much welcomed.
Yeah, that's really nice. It's nice, I guess, having that ability for the people using your services to see that, you know, the stuff that they say they need is going into a pipeline where it's becoming actual content further down the line. So yeah.
And I guess, you know, one of the things to add into that, you know, it wasn't easy. You know, I know this sounds like it was really nice and easy without bumps, but actually one of the biggest hurdles we had, and they won't mind me saying this, is actually staff. You know, not many people like a camera being put in front of them or hearing their voice being recorded. And I think a lot of our staff are very keen to do the sort of worksheets, written resources that people can access online. Whereas actually we were told that, you know, seeing that friendly face, that smiling face, or hearing that canon voice are the sorts of things that people wanted. So we had to provide quite a bit of investment to staff around kit to do these recordings, but also about just confidence. You know, they're the subject expert matters. They're the people that know what they're talking about, and it's just, you know, it doesn't matter if they're speaking one-to-one with someone or via a lens. You know, it's the same sort of stuff that they're saying, which was quite important. Yeah,
and I think, I mean, there's a lesson in there, I guess, for everyone in the room about the ability to test content and see what it's like. That you don't need to kind of leap head first in creating a giant suite of videos. Is like, try one and see, you know, use Google Analytics, use your users, understand what people think of it, and then go from there. That it doesn't need to be this big kind of leap into the unknown. There's some good questions coming in the chat. John, do you want to pick up some of them?
Sorry, let's see. Yeah, Callum, you got a great question about challenges of if people, you know, digital inclusion is potentially a problem to overcome in terms of if people are starting to use devices. How easy is that? And I wondered if either of the speakers had experience of that.
Yeah, I can jump in first, and then Elizabeth. So we, our service delivery face-to-face pre-pandemic was in some of the most deprived communities in Scotland. And when we're moving to hybrid, we had to take that into consideration. We knew that libraries, where a lot of our counselling and complementary therapy appointments were shut. So if we were doing counselling, people just wouldn't have access to kit. There were great programs out there. In fact, I think SCVO was one of them, that were renting kit, or you could apply for grants to get kit to dish out to people. But that added a layer of, you know, complexity for us, and just how do we do it. So that's why we really focused on trying to keep things as simple as possible for people. So telephone counselling, if people didn't have access to a telephone, then being able to provide that. We didn't use, and I can't remember for the life of me the name of the tool. The NHS were pushing hard their video conferencing tool during the pandemic. I can't remember what it's called, sorry. And, you know, Teams was getting pushed quite a lot. We stayed well clear of that. Because that's the one near me, because you had to download stuff, you had to have certain style of tech and all the rest of it, whereas we actually stayed with Zoom. And I remember being on a call with a chief exec saying, that's absolute bonkers, you're delivering services on Zoom, it's not safe. And actually, you know, the updates that were coming regularly from Zoom were showing the complete opposite, that it was a safe tool and it was accessible, because all people had to do was click a link on their phone and either do it via audio or video. So it's been something that's been in the back of our minds, given the audience that we support. We think we've done okay. We've not seen a drop in people from those communities accessing our services, but could we do better? Absolutely. It's watch and brief. It was actually interesting. I saw that, in fact, if you don't know, the census people are trying to get rid of all the laptops that they booked. So I thought, oh, this is great. We can get some laptops and dish them out to folk. It's absolutely fantastic. And our IT folk were like, no, you can't do that. A, the restrictions on the funding, but B, it's Chromebooks. And I didn't know this, but Chromebooks are apparently really, really challenging for service delivery because your IT department can't control them. I don't know if that's true or not. They just didn't want me to apply for funding. But yeah, it just, you see all these things coming up and you think, oh, that's great. And you want to grab that free resource, but actually the practicalities come in and you realise that you can't. Bit of a waffle there, but there we are.
Elizabeth, I don't know if you want to come in on the digital inclusion side as well.
Hi again. Well, I guess from a digital inclusion point of view, we try to, we have a lot of guests who are older and kind of maybe, really had a bad experience with tech or just say they aren't interested. And some people, fair enough, they're just not interested and that's it. But we do try to get everybody involved if we can, or even have a chat with them. Like I had a lovely lady who said she wasn't interested in tech at all. Her family sits around and uses their phones and tablets, but she's not interested. But we're lucky in that we have all the devices in the room. So I didn't mention as well, we have an iPad in every room as well. So I was showing her how to use the iPad, and she was really unsure about it, but by, give her another 5-10 minutes and she was scrolling through all her favorite programs and going, oh, I didn't know this was in there. So I guess it's, in our case, just trying to get people to try things out, and fair enough if they don't want to use it. But, and also allay feelings about things like Alexa's listening, which, yes, it is, but it's really listening to the wake word or for the wake word, and then it will record what you've said and it will delete if it doesn't know, if it doesn't think it's a command. So it only records the voice history of things that are, that are relevant. So anyway, just kind of allaying all those fears. So we don't really have such an issue of purchasing things, but if it's something like, if we know that they might need an environmental control, which we can't afford, like something like a possum, which is in Scotland, an environmental control, then we can refer them onwards to their local authority. But it is a bit of hit and miss whether their authority will support them with that. But that's all we can do at that point. So yeah, buying their own devices is not something we're as involved in.
Thanks, Elizabeth. That was really interesting. And there's a really good follow-up question, like for both of you, from Claire there, which I'm really interested in, actually, about how you measure the impact on mental health journey through the delivery. And I guess probably to add into that, like not just the mental health journey, but like ultimately, I guess, what's the impact on doing any of this stuff? So yeah, Elizabeth or Rob would be interested to hear that.
So we've been on a journey with this, and we're not 100% there. We're probably 98% there with it. But we last year introduced Salesforce to the organization after years of can we do it, can we not do it, and it revolutionized the way of our working, and actually took us back to basics. What do we need? What do we want from a data point of view? How do we evaluate? And what's the user journey as well? So, I'm Cancer Support Scotland. You walk through the door of one of our services, you were handed with a booklet of paperwork to fill out on your first appointment, from everything that you could possibly think of, and then halfway through you get another wad of paperwork, and then at the end you get a wee bit of paperwork, and it was just sitting in boxes and filing cabinets and not doing anything. So Salesforce has really helped us that we've been able to get that data online, but we were able to think about the user journey. So when someone's first referred to us, it's done via the website, or it's an online referral form. That then creates the record in Salesforce, and that records then follows people and automatically sends emails to people throughout their journey. So we're able to measure through things like if there's any psychologists or counsellors out there, things like MyClaw or Core 10 assessments, and then other evaluation tools throughout the journey. And it just means that we're able to regularly follow someone's journey throughout their time with us, but also report on it as well. I'm able to go in today and see, for example, how many people we are supporting with prostate cancer, which previously we were never able to do. We're able to effectively manage safeguarding issues. Or the one thing that came out of it was at the start of the year, we were starting to see, anecdotally, we always knew that we were supporting people in the early stages of cancer diagnosis. But we never had the factual data because it was in papers and no one could be bothered putting it in a spreadsheet. Whereas now we're able to click a button, and I was seeing trends that actually were moving from that sort of stage 1 and 2 cancer to actually we're supporting more people with palliative cancer, end of life. And it actually enabled us to do quite a lot of media work around that and engagement with the Scottish Government and other charity partners to say, actually, we're noticing this is an impact of cancer, COVID, and, pausing, screening and all the rest of the issues that you're all well aware of from the news. And we were able to start pivoting our staff to just provide a wee bit more support because we didn't want them getting compassion fatigue or burnout as well. So data has for me been one of the game changers. And I sat on one of Ross's courses with Maddie many years ago, and I was always fed up at hearing them talking about data, and it's not been until the last year that I've actually appreciated that they were right, and we it's opened up so many different doors for us.
Thanks, Rob. There's nothing Maddie and I like more than being told we're right. That's probably our favourite thing.
Well, you can send the cheque in the post. Mince pies will do.
Elizabeth, anything you'd like to come in terms of measurement or knowing the impact that you have on the people you support?
Yeah, apologies, my connection just stopped there, so I lost the chat, but I did see, how do you measure the impact on the mental health journey through the delivery of online services? Well, we don't have any online services, and it's not something that I've been doing, measuring the mental health impact, but we do have a physio, and she's very interested in mental health, so I'm not sure what she's doing with that. And we also have occupational therapist who's working with well-being for guests as well. So I think that would be more their thing than what we're doing. All we do is we have a survey looking at what tech people use and what they're interested in using, and then at the end what they've taken away from us, what they've got. The next time they come, we can ask them what items they've purchased, but it's not to do with well-being in our case. Although that would be interesting to measure, but we don't have any online services.
Thanks, Elizabeth. No, that's really good. That's really useful. Hey, Sean or Maddie, anything in the chat or anything you want to pick up on?
I think something that struck me about both the things we heard about this morning were about how you actually ended up using consumer grade devices or approaches. So it wasn't about saying we need to procure something which is specific to the health sector. And I think that's quite interesting, because actually, I guess, Rob, you talked about, there's this challenge about is Zoom safe, but actually it's about meeting people where they are, and that's affordable and accessible. And I guess that's maybe an interesting trend, is there's a lot of aspects of longer term care where there are devices or approaches out there that aren't kind of from the healthcare sector, which can be more expensive.
Yeah, we definitely found, that's why we're doing this. I wouldn't say promote, but we show people the inexpensive options that are, that everybody else is using. And a lot of people here will want to be like everybody else. They don't want to use some specialist device if they can have an iPhone like everybody else, or a phone that they can use like everybody else seems to have, or a tablet, rather than having some specialist, usually very expensive device. And we've had a few people say, oh, there's wires all over my home. They wanted to, I've just had my home redone and they want to put wires everywhere for this new thing they want to put in. So, I mean, obviously those products have their place, but I think if people can use the devices that are off the shelf consumer, just normal devices for as long as they can, then that makes them feel normal and understand what everybody else is talking about as well. So that's one side of using that. And they also do work well. So
yeah, great. And I think there's a question, Rob, from Anna about service users seeing data. So I wonder if you have any thoughts on that.
Yes. So can people see their data? Of course, anyone that wishes to ask can. If they're coming through website route, so for example, if you're accessing the self-help mindfulness resources, you would need to ask us, because the engagement's different. It's not a one-to-one engagement. You're get given login details to once you've filled out the referral form and done the pre-assessment. So you could ask for that data. With counselling, befriending, complementary therapy, absolutely. And actually that's part of practice, is that, people are reviewing the journey that they're going on. And I think that's quite important for people to see that they are, making progress. There was one woman that was in here last week, and she's, from our physical treatment side of things, keeps getting knockbacks, nothing seems to be working. And actually it was quite a powerful thing for the befriender to be able to say, well, you've been doing these evaluations with us, actually things are improving, and they had a discussion around that. And actually for her, that was really reassuring, that actually she wasn't, I don't want to say the word a failure, but not everything was failing for her cancer journey. That the well-being side of things was slightly improving. Hopefully that answers your question, Anna. If not, do come back.
Yeah, it does. Thank you. Yeah, thank you.
I actually had a related question on that one, and I don't know if it connects directly with the work you're doing, but I was thinking about, I guess part of self-management is giving patients a bit more visibility into what's going on with them. And I can imagine in some situations that could potentially add to anxiety, if somebody is, say, I don't know, monitoring blood sugar very closely, or whatever it might be, they might sit there thinking, well, I'm looking at this minute by minute, and that might contribute to anxiety. And I wondered if anybody had any thoughts on that. I know it doesn't directly connect with what you're doing in your settings, but just thought I'd ask.
It doesn't, but something that came to mind just as I was finishing up there, I was at an NHS conference years ago, and someone from Catalonia was speaking about I think it was Catalonia, was speaking about their healthcare system. And as a patient, you get access to your everything. So anything that's, focusing on, so that it is Catalonia, you basically get access to your data, and it was phenomenal. So I could go in and see the results of my scan. I might not understand the scans because I've not got a degree in that, but actually you could see your scans, you could see, what the consultants were saying about you. And, I was just thinking, probably 5 years on since I heard that, and we don't seem to be any further forward in Scotland or the UK. I know that from a cancer perspective, they're starting, I think next year I heard a rumour that a charity is launching an app that follows your journey, which will be interesting, but there doesn't seem to be anything that really ties into what you're talking about, John, that actually, you can see your whole journey on a web link. And, I do think it's something that we should look at progressing towards.
Thank you. Peter?
Yeah, I'm a member of the Digital Citizens Panel through the Alliance in Scotland. I'm also involved in what they call the Quest research programme at Glasgow University, which is looking at wearables, which will monitor your health, your gait, your blood pressure, your heart rate, diabetes a lot. And it'll then feed into a mini server, and it'll be sent back to the main server, and they can pick up the data on this. It won't be if you want it anonymous, it will be, but obviously if you want your health monitored, you won't want it anonymous. So any problems will be flagged up. So within this area, things are moving very quickly. There's people from all over the world involved in this Quest programme. I've only been in it with 3-4 meetings on Zoom, but I'm dying to get into university and open up their toy box and see what they've got inside it. So things are really progressing fantastically. And as far as getting your data, and under the GDPR, General Data Protection Regulations, everybody's entitled to see what data there is and correct it if it's wrong. So I just thought I'd throw that in.
Thanks, Peter. Yeah, that's really useful. And I think, I mean, there's very, very few examples in the third sector of someone comes in as a service user and then actually can see where they're at on a journey, and regardless of what your organisation is and the type of support it provides. It's just a very, very unusual thing. But I think it'd be a bit weird if you like applied for car insurance and you couldn't go on the car insurance website and see how your application was progressing, or if you'd been knocked back for a loan, why that was, or like any number of digital services in the commercial sector. And it's not something we've really got to as a place in the third sector, or the examples are really rare. And I think it's getting people to understand the difference between I have access to my data if I ask for it under GDPR versus this is a tool, particularly for self-management, about me engaging with you in a meaningful way that is not just like I come to a service and it's 9 to 5, or I do a self-help thing on a website. And there's kind of often nothing in between those two things. And so, yeah, I mean, it'd be interesting, people in the room, if anyone's doing that, or if they've got aspirations to do that, I'd love to hear from people.
Can I just add there, Peter, I'm very interested in wearables as well. We were thinking about getting a smartwatch just to be able to show people how they work. But actually, we think they're too heavy probably for our guests. So I'm just interested in things where I know there are pieces of material you can stick on people, which will take stats as well. And we have a nursing station, so it'd be really, you know, and carers take handhelds around with them. So if there was something that came up or something that changed, it would be great to be able to, you know, signal that right away. So yeah, I'd be interested in hearing what comes out of the wearables. I don't know whether you're looking at alternate wearables or just kind of off the shelf ones.
There's a lot of stuff prototype at the moment in the design process. Oh, you buy the off-the-shelf stuff, but sometimes it's got to be tweaked for the individual's needs. So it's certainly an ongoing process. I think it only started up last year. So there's an awful lot of work being done. There's people all over the world interested in it.
Thanks, Peter.
Can I just say as well, I'm also very interested in wearables. I'm from Paths for All, who are a walking charity. So obviously we're all about the benefits of physical activity for everyone, but including, you know, for self-management reasons. So yeah, linking that sort of health data with physical activity data is really interesting to us as well.
Thanks, Anna. John, anything else on that?
Something I was wondering about, because I got the sense from both organisations you're kind of trying new stuff and experimenting, and I suppose whether you had the sense of people's expectations changing over time, because I think, Rob, you talked about digital enabled you to have information support available at times it wouldn't have been available if it was just relying on face-to-face timetable. And I guess, Elizabeth, in a way, you're sort of showing people a new world of things that could be very awkward or difficult. You can use technology to help with that. And I wondered if you're seeing, not just in individual cases, but overall, are people having higher expectations of what's possible?
Certainly, yeah. The people coming in are becoming more knowledgeable because we get repeat guests a lot. Some people come even up to 4 or 5 times a year for a 2-week stay. And they come now with a list of questions or things that they want to try, things that they've heard about. And I'd say about 70 to 80% of the guests coming over at a time now will ask for support with different kinds of tech things, which is great. So it just really shows us that we're doing something that people are interested in and also can really benefit their independence. So yeah, I think we've seen an uptake in that. Sorry, does that answer your question?
Yeah, thank you. While I'm chatting, I just have a quick anecdote about a wearable. A family member broke their hip earlier this year, and they're quite a pessimistic person. So in that kind of recovery phase where they needed to walk a bit further each day, if they'd been left to their own devices, they might have felt, well, I haven't been able to walk very far, but using a step counter and a phone meant they got quite into logging their distance. And it was an interesting piece of encouragement to them, because I think we were always saying that you are doing more, we can see that you're more active, but without having some statistics to hand, it was quite hard to convince them. So it's an interesting example.
Any other questions from anyone else in the room? Or any thoughts or reflections? Iona?
Hi, I have one about, do you ever come up against any kind of resistance to the digital side of stuff from clients? I see a lot of clients come through, it's, I don't have to do this, and I don't have to have this password, and there's so many logins, and that's kind of a big challenge for me. So I wondered if that kind of happens to you guys, and what methods you use to kind of get past that and to support that kind of mindset.
Good question. The reason why I nodded originally is I thought you were going to say staff. I think more resistance from staff than people that access the services, if I'm being honest. No, I don't think. I don't want to say categorically we've not had that, but because I'm sure we have, but I've not heard of any recurring issues of people saying, no, I'm not logging into this, or this isn't secure, etc. I think because the health services moved digitally and our works have all moved digitally, people have just become used to it. And actually, you might turn around and say, well, what about older generations that aren't in work? Actually, I find some people that are 70 plus actually better at technology than some 40 to 50-year-olds, quite frankly. So we've not really seen sort of a huge resistance to it, and people are more than willing to fill out forms online because they know it's secure. So yeah, no, sorry, not to be more help, but we've not really had that.
Hi, just to say, yeah, we have had some resistance, and I think it's people who are just afraid of looking silly. They don't know how to use it, whereas they're very competent in whatever else they've done in life. So it's something new, and I think just what we've tried is just going very gently and approaching people and trying to use language that isn't off-putting or unknown to them. And I guess getting them right in there, demonstrating things simple to use, like Alexa, that, oh gosh, I have one in here. I hope it's not going to go off. But it's simple to use, so it gets them into it and they can see what it does, and then they can try it themselves because we have them in their rooms. That's all we can think of for now.
Thanks, that was a great question, Iona. Thank you. John,
No, I think, yeah, I was thinking as well, perhaps, Elizabeth, maybe part of your context is because people are there with a bit more time and less pressure, so they're not trying to do something new in the midst of their everyday life, which can be difficult, I would imagine. So maybe the fact that they're in an environment where there's a bit more time and space is probably helpful as well.
Yeah, that definitely is the case. They're relaxed, they're coming for a holiday, so yeah, it's quite a nice space to meet people and try and show them, and also they can see other people around them using it, so that always helps too, when they can see their peers trying it too.
Peter?
Yeah, I listen to what you're saying, Elizabeth. Yeah, it's fantastic, but it's through the digital citizens panel. What we found is there is a lot of resentment against some older people and people with disabilities against using technology. And the biggest challenge is trying to find assistive technology for people who you've got to find your way around about how they can actually access just everyday living. That's a big challenge. And I actually have a friend who is retired as a dentist and refuses to use the internet, refuses to wear a smartwatch. So there are a lot of challenges to get people on board. And as you say about older people, I mean, I'm over 70. technology doesn't bother me. I just love it. It's part of my life. Always has been for about 20 years now.
Yeah, we see a real mix of people at Leuchie. So there's people who, you know, like you said, they're in their 80s and they're flying away with technology and really happy to try new things. Whereas there's other people of all ages, we mostly do have an older population coming here, but some people are really resistant, and some younger people too, just scared of trying it. It's mainly fear, I think, of trying new things. But yeah, it's also, you're right, it's knowing what to purchase too.
Yeah.
And you know, when they have certain conditions, and that's where we're trying to help with the switches that we have and things like that, different technologies, mounts for phones and things that can hold it for them. And voice control is a huge thing. But there's a lot of other technologies out there, and that's why I was saying we can't take everything all at once. We've got to really learn it well. So we have some eye gaze things that we've purchased, but we really got to test them out well so that we're very confident using them before we then try and demo to other people. We want it to work first time, or know how to fix it for them and adjust it for them, and not just put something on that is then going to put them further off technology.
That's great, thank you. So we've got a few comments. I think there's a quick question that might be for you, Rob, about client questions and interactions with pre-records. And I suppose that's about if you're recording a resource, it's maybe not the same as if you were running a session live with client interaction.
Yeah. So let's take mindfulness. We tested doing Zoom calls for mindfulness and in person. The in person, as you can imagine, was busy, but the Zoom calls weren't, for a variety of reasons. So that's why we pre-recorded everything and put it online. And you can't get access to that unless you've put in your referral form, and then you get access to it. And then we get all the pre-post during surveys that go out. We're currently looking at a tool that you can get on the website that actually after every session, there's automatic feedback. So a quick thing comes up on the website, you know, thumb up, thumb down, thumb at the side. And then depending on which response you do, you can then put in some feedback. So we're currently looking at that as we go along. Our service team do look at the interactions with, you know, we're not talking hundreds of thousands of people, so that they do look at the interactions with the mindfulness resources, and depending on where people are at their their evaluation, we would give them a call just to see how things are going and check in as well. So we're trying to make it as interactive as possible, but effectively it's a video that you're watching online, so that it comes with its limitations.
A quick thought on that is, I guess sometimes a pre-record is quite helpful for people to understand what something is, you know, rather than having a big article saying, well, it's like this, and someone actually experiencing a bit of what it's like might be quite a helpful.
Yeah, and you know, we know this anyway, but the audio and video resources are far better utilised and engaged with on our website than in social media, etc., than our written stuff. So the self-help fact sheets that we've got on there, they do get a following, but the videos and the digital the audio recordings are far more engaging, and people engage with them than the written stuff.
Great, thank you very much. I'd like to do a verbal plug for our next DigiShift. You should know it will be on the 15th of December. So normally we have DigiShift at the very end of the month, but obviously Christmas is going to happen at the end of next month. So we thought we would bring DigiShift forward, and we're going to do a bit of a review of the year. So we're going to look at, we've got some interesting speakers coming to talk about some very big changes and trends, but we're also encouraging people to come and reflect a bit on what's worked for them in the last 12 months. And we'll be talking a little bit about ideas about how you might shape your strategy next year. So it should be a very interesting session. Sorry to interrupt with that plug. I feel like a kind of advert on a podcast is kind of popping in. But there we go. We're getting near 11 o'clock now, so I just wanted to say a very big thank you to our speakers, to Elizabeth and Rob, for sharing so much about their experiences, and thanks to all of you for such interesting questions. Loads of things I think to think about. It's a really interesting area. I think, as Peter said, you know, there's so much developing so quickly, and there'll be loads of things to see, I'm sure, in the months and years to come. So thanks very much, everybody, and we'll see you next time.
Thanks, everyone. Thanks for coming.
Okay.
See you
Cheers.
Christmas time. See you soon.